This conference will now be recorded.
So pleasant.
Okay, well, thank you everyone for joining us. Thank you, Dr. Ronan. And whenever you're ready, take it away.
Okay, so good evening, everybody. My name is Mike Ronan. I am a pediatrician. I work at Baldwin Harbor Pediatrics, which is part of ProHealth, which is a big physician blob all over Long Island, and we have lots of offices all over the place. And I work with Dr. Jetter, who's also in the call tonight. And the presentation that Deb asked me to do was a back-to-school checkup, where we're going to talk about a little bit about why it's important to have your annual checkups, and then also discuss and answer questions about that people might have about going back to school this year, because as everybody I'm sure knows, this year is weird. So what I'm going to do is punt up my slides, and we'll start from there. So let me see. And I apologize, I got to share my whole screen here because this thing won't do it without glitchies. And let's bring these up. And make it hide that, and then let's go back to slideshow. Okay, so can everybody, I'm assuming everybody can see these because we tested this out before. So we'll just move on from here. As I said, my name is Mike Ronan. So talking about annual checkups, it's time for your checkup. So why is it important to keep your annual checkup with your pediatrician? There are a number of things that we do on an annual basis that it's good to keep touch with, especially because children are always growing rapidly and everything's changing with them on an annual basis, certainly much faster in the younger years, but as they get older, it's good to have that yearly touchstone with them. So some of the things that we do, we monitor growth and development. We can give the children their required vaccines for school and recommended vaccinations. We can answer any questions that have arisen since the last time we spoke with you, either their last checkup or the last time you encountered us about your child's health. Part of what we do as pediatricians is we would like to encourage exercise, healthy eating, and healthy behaviors. And then it also gives us an opportunity to follow up on any ongoing issues that you may have had that you've been addressing with us in the past. So all of these things, the annual checkup is an opportunity for us to check in with you and also for you to check in with us about things like that. So moving on from that, to go or not to go, that is the question, which is also, I didn't put in here about to go or not to go to the doctor. So people have some concerns, and a lot of people haven't been. We've been seeing plenty of checkups in the office, but there are still people who have concerns about leaving the house, going to the doctor, going to the store in the current environment of the pandemic. What I can tell you is what we're doing in our office, and what most offices, from what I've heard, are doing, is that we're taking extra precautions to make sure that rooms are extra clean, that we're not congregating people in large numbers in places. So for example, our office, when you come in for your physical or you come in for a sick visit, first of all, we're separating the physicals from the sick visits in separate rooms. We're bringing patients in only when we have a room available. So our office, you can, whoever's microphone that is, if you can mute yourself, that'd be great. Thanks. So we are having our patients come in, and they call us from the parking lot, and then when we tell them they have a room available, then you come in and you go right to your room, and that's where you stay during your entire visit with us. And then once that is done, you walk out, collect any papers you need, go back to your car, nobody's sitting in the waiting room, and we clean the room, and then we bring in the next patient. So, and then we're following enhanced cleaning procedures. Everybody's wearing masks. We are disinfecting things left and right and up and down. And we're trying to keep the children who are sick to different parts of the day or completely different parts of the office whenever possible. So that's how we're keeping things safe for checkups. Now, the question that I'm really addressing on this slide is to go or not to go to school, which I'm sure is on everybody's mind because we all have children and they're supposed to be going to school. So what I wanted to talk about is just some brief overview stuff and then a couple of points, and not to make a case in one direction or the other, but just to give everybody some information as to what the current state of affairs is locally and nationally, and then some things from around the world. So first of all, most school districts and private schools have had to submit plans. In New York, it's submitted to the state, and those plans have to follow the state's guidance, which was given to them by the state at various times over the summer. From what I understand, most districts and most schools do have some form of in-person attendance. Some schools are putting off in-person attendance until later in the year. Some schools are starting with hybrid models. Some schools are going 5 days a week in. Some schools are doing a mix. And for the most part, most schools and districts are allowing children to have a full remote option in some fashion, meaning that if a child is not able to go in for whatever reason, parents decide that that's just not in the child's best interest at this time, then there is a full remote option that I've heard for pretty much every school, for everybody I've talked to. So here are some of the issues about going in. So why is it important to go in, and why is it important maybe not to go in? Studies have shown all over the place, and most educators agree that most children are not going to be able to learn as effectively remotely as they do in the classroom, especially in the younger age groups. So the K through 5 set in particular, academics is not the only thing that they're acquiring when they're in school. They're actually learning how to socialize with their peers. They're learning how to interact with their teachers. They're learning how to structure their day. They're learning how to handle themselves in an environment that's not their own room. So those are an important piece of what they're learning in school, not just reading and writing and science. So the second issue that a lot of people have is that parents have to work. And for a lot of parents, school is where the children go when they're at work. So the issue with that is that if schools are not open or children don't have an option to go in, then parents may not be able to go to work, or they have to make other arrangements for childcare. So the next issue, or not issue, the next point is that school plans for each district and for each school are following the guidance of the state, which is largely based on the known science. And when I say known science, it's, coronavirus is still relatively new in a scientific perspective. And so it's based on what information we've been able to gather to this point about the virus and how it spreads and how we can prevent it from spreading to people. And the hope is that, and the purpose of the guidelines is that if people do follow the state guidelines, both people going to school and the schools themselves, with case counts in New York being where they are right now, the risk should be low. And that risk is not just for the children, but also for the teachers and their parents and any people living at home. If those plans are followed, the goal is that those plans are going to minimize any risk to anybody participating. So moving on, staying home. Some concerns that people have, some families have high-risk individuals who live in their house. They don't want to risk exposing them to the coronavirus if the children catch this at school, which is certainly a concern for some people. Some children themselves are at higher risk for getting ill with the coronavirus, certain underlying conditions that we know put everybody at increased risk, although children generally as a group are not at as high risk as older adults. There are still certain children who do have things that would make them riskier for getting very ill if they contract the coronavirus. The next issue is that the science is still uncertain as to what is going to happen when the schools do open, although we are getting more and more insight as time goes on. We have some insight from other states where schools have opened. We have insight from other countries where the schools have been open for a while, and that can give us some insight as to what we might expect here in New York. And then the final thing is that there are actually some children who do quite well with remote learning, that they have actually thrived at home. They've been better off not in the classroom environment, and they've been able to meet their academic standards without actually being in the classroom. So for some kids, the remote learning seems to have been a bonus. But in general, that's not most kids. So some interesting points. Anybody who isn't reading the papers or listening to the news, New York State's current case rate. So the case rate is the rate of positive tests among the number of people who have been tested. So that has been under 1% for the past several weeks. So what that means is that of all the tests that are done in New York State, less than 1% of them are coming back positive for coronavirus. Now that's the virus test, not the antibody test. Antibodies test for if somebody's had the virus in the past. The actual viral test that we're talking about here with this under 1% is testing directly for the virus. So some other interesting points to note, there have been schools in other places that have reopened with no outbreaks when strict protocols are followed. One example is in the United States is Stark Community College. In Ohio, they've been having classes for about 3 months now with in-person learning, and they have not had a single case of contracted virus that can be traced back to the school. And then there are several countries that have been opening schools, or some even never closed, Sweden and Taiwan, for example, that have not had upticks in their coronavirus cases, even maintaining schools open. So those are just some things that I found interesting, and then a few more points. So Denmark and the Netherlands, which actually locked down for a period of time, but then opened their schools up in May, and they saw their cases continue to drop even when the schools were opened back up. Finland, Belgium, and Austria, they found no increase in spread of the virus when they reopened their schools. And then just some things that have happened in New York. So other districts in New York, particularly down south, where case rates were actually quite higher than New York at the time. When they reopened their schools, they had to modify their plans due to the outbreaks, but they had their protocols in place for what they were going to do as a response to any noted increase in cases, and they followed their plans, and they were able to get their cases to come back down. And of course, their protocols, every state has its own protocols. Every state is doing its own thing for as far as guidelines go, but when they were following their protocols, they were able to get things back under control. Although you will read about cases of outbreaks where, particularly in school districts or schools where kids actually weren't wearing masks and were on top of each other. So something to note. So another question that people may have is to test or not to test. Right now, New York State guidance does not require testing for children to go to school, but individual districts and individual schools have come up with their own rules as part of their plans. So the protocols sometimes require testing before going to school, sometimes require testing before returning to school if you have symptoms or if you come in contact. And that's going to depend protocol to protocol. So again, just to go through the two kinds of tests that we do for this, the antibody test just tells you if you've had it in the past. That's a blood test. And that's telling you if you were infected with the virus and then made antibodies to it. And then the other kind of test is the viral test, which I'm calling the nasal swab on here. And that's when it's telling you if you have virus in you at the time that the test was done. And that depends on the sensitivity of the particular test you have. Certain tests are more sensitive, pick up less virus in you. Other tests require there to be more virus in you. The rapid tests that people read about tend to be less sensitive, meaning they require more of the active virus in your system at the time in order to test positive, whereas the ones that take a day or two typically are amplifying any available genetic material and therefore are able to be more sensitive and they can pick up on less virus. So just as a note, ProHealth, the organization that we work with, our office is capable of doing both of these tests, and many pediatrician offices are capable of doing one or both of these kinds of tests. And they're certainly the kinds of things where you can reach out to your pediatrician, and you should if your child needs to test at some point. So I think that's it. Yeah, so just a quick little, so what should you do? And really, for every individual family, it's going to be an individual decision. So you should take the risks and benefits for your child and your family into account, and that's the risks of going in versus the risks of not going in, and the risks and the benefits of going in versus the benefits of not going in. And you're going to have to make a decision based on that. No matter what, if people follow protocols, whether it's protocols for not being in school or protocols and guidelines for going into school, if people follow those protocols, then we should be in a pretty good place. And if people are responsible in following those guidelines, especially for travel and quarantining, then right now with our case counts where they are in the current plans, it looks like it could be actually okay. And then the last thing I'm putting on here is just a plug for flu vaccine, because we're pediatricians and we encourage everybody to get flu vaccine. And that's actually a national recommendation from the CDC that we should get as many people vaccinated against the thing that makes people sick in the winter that we can vaccinate you against, because we don't have a vaccine yet for coronavirus. And that is my entire slide presentation. So I'm going to stop sharing my screen and open it up to any questions, which you're welcome to type into the chat, and then I'll read them out from the chat. And if that fails, we can unlock people's microphones.
So I'll actually stop recording at this point, so
okay.
People can feel free to type in there.